Hello there and welcome back. My name is Dave Hawkins. Recently I had a question from a friend of mine named Shane who talked about recently going through rotator cuff surgery. And so today what I wanted to do is give you a couple things that you can do to help in that process of recovery. One of the important things to remember is that your body has to have time to heal. And so you don't want to disrupt the healing process that's going on in your shoulder, but also we don't want your hand or your wrist or your elbow to get tight in the meantime. And so a lot of times the doctor will have you in a sling, but you want to make sure that you're still using that hand, you're still using the wrist, you're taking the sling off every once in a while and moving that elbow, right? If it's too painful to actually move the elbow this way, you can also take your hand, your opposite hand, and help in the movement of that elbow. So as we're allowing this to heal, we're not allowing the other things, other joints to get tight. The other thing that you can do, a couple of passive movements, and it's important to understand the difference between passive and active. Active is when I take my arm and I move it myself. Passive is what your therapist is going to do with you, where they take your arm and move it for you, or an exercise that we'll show you here in just a second. The first one is a relaxation exercise, which is called a pendulum swing. And it's important to remember, again, when you're doing a pendulum swing, that I'm not swinging the arm like this. I'm taking my feet and using the momentum of my body to let that arm swing. And you can see that my arm's not going through a whole large range of motion there. I'm doing circles. I can also do forwards and backwards, again, using the momentum of my body to help with that swing. Okay? Again, trying to keep that movement passive. Okay? The second that we'll show you is a little table stretch. So I'm sitting down at a table, I'm getting on a rolling stool, I'm putting my arm, I may have to do this, I may have to get my arm out there like this, and then I'm scooting back, right? And you may not be able to go very far. It may be painful to do, and what you want to do is bump into that pain, not necessarily plow through it. Okay? So I'm here, my arm is stable, I'm not doing this with my arm, I'm taking my body and moving away from it, getting a stretch through that arm. Okay? In your initial stages of recovery, those two things are going to be enough. And then pay attention to what your physical therapist and your doctor are telling you as well. It's important that you continue to try to work on movement. I know that's been very successful with a lot of the patients that I've seen. Those two things are very basic things that you can start at the beginning. Appreciate you joining me today. Hop over to davidhawkinspt.com and leave comments, ask questions. Feel free to share this information with your friends and family who also maybe battle with these same types of injuries. Thanks and have a great day.